For years, men have used Viagra to improve their sex lives.
And now a new procedure promises to do the same for maturing women.
Morning anchor Felicia Rodriguez introduces you to the OShot. Some women say it's like finding hidden pleasure you thought you'd only find in the movies.
Oh, who can forget this memorable scene from When Harry Met Sally?
Yes! Yes! Yes!
Want what she's having? Now there's help for women who struggle in the bedroom.
Men.
Marcia.
Hi,
How are you?
Oh, good to see you.
So tell me.
Well, it's been amazing.
64-year-old Marcia Hollander underwent a procedure to help improve her sex life.
I realized that as much as I was turned on, my response and my ability to reach an orgasm had diminished, and a lot because I know of age and hormonal changes.
But when it comes to the big O, studies have shown that 10% of women have never experienced one. But a new procedure could change that.
My husband and I have been married for 10 years, together for 14. 2 young kids, still madly in love. Just a couple little issues we're dealing with right now. Big O. After we had kids, I noticed that my sex drive is definitely way down. Orgasms, for me, not so much. I'm not having them as frequently, so it makes me not want to have sex as much. I really want to just feel the intimacy again and feel sexy.
Dr. Lisbeth Roy says 43% of women report sexual problems, including painful sex, arousal issues, vaginal dryness, and decrease in desire. After going into menopause at the age of 38, Heidi thought she just had to live with these symptoms.
Well, I was really intrigued when she mentioned the OShot. Dr. Roy thought I would be a good candidate. And of course I was like, oh, needles down there, maybe not such a good idea. But she assured me that it would be quick and painless.
All right, let's get started.
First, there was the vampire facelift, where doctors took patients' blood and isolated platelet-rich plasma from it. Then they injected it into the skin for a more youthful look.
Looks good.
Orthopedic surgeons also use this technique to get athletes back on the field. The plasma helps them heal faster after an injury. Now, doctors are using platelet-rich plasma to deal with sexual dysfunction and calling it the OShot.
It contains many growth factors and healing factors that actually will stimulate stem cells. So regardless of where we put it, it will stimulate regeneration of tissue.
But tell us exactly where you put the injection or around what anatomical part so that we can show people at home.
Let's pull that animation up if we can.
We put about 1 cc of platelet-rich plasma directly under the clitoris, as you see there. And then we put about 4 cc's in the upper vagina between the top of the vagina and the urethra. It extends down when you do that, so it actually does plump. And there's an immediate plumping just from a filler effect. And then over time, with the collagen production, the elastin production, it actually may be relatively permanent.
When we would have sex, it would hit my my uterus, and it would hurt. But I didn't tell him about that. I kind of felt insecure a little bit. I didn't want to make him feel bad about himself or that he was doing something wrong. And I felt inadequate myself because I felt like, I can't really enjoy it. I can't, give him what he wants. So I kind of had to sort of pretend a little bit about it, and it was kind of wrong of me to do that, but, I didn't know what else to do,
There is no way I can have an orgasm if I'm having pain with intercourse, but I'm afraid to let my lover know when I'm hurting.
My wife just never seems to be in the mood, but after we get started, things seem to be okay.
My wife gets very aroused, but there's nothing we can do or say that brings her to orgasm.
Mid-50s, kind of mid-menopause at this point, which includes a fluctuation in hormones, which causes a lot of vaginal dryness. So I was suffering from tremendous vaginal dryness, painful intercourse. That was one of our big things, and definitely a decrease in sexual arousal and just once a month, if he wanted sex, we would have sex. That was pretty much it.
Let's talk about you and me. Let's talk about all the good things and the bad things that make me.
Salt and pepper.
Salt and pepper. Let's talk about sex. That's what this next story is all about.
Okay.
All right. And
I'm blushing already.
I know. Well, okay. There's this new something that's being offered, and it's called the OShot. And Christy Siefkin visited a doctor's office to learn more about this new way to boost a woman's sex life.
Sally Albright knows what women want.
Yes! Yes! Oh! 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 Oh, God.
And you don't have to dine at Katz's Deli to get it. It's called the OShot, 2 quick injections that promise to reignite your sex life.
And what it does for a female is rejuvenates the tissue that's responsible for their sexual response.
Doctors first apply a numbing cream and then use a very fine gauge needle to reduce pain.
And we're just injecting about an inch into the vaginal canal. There's a small area of soft tissue that we're trying to enhance. So you feel a slight fullness, certainly not uncomfortable. And then we're placing it right under the clitoris. And you think that's going to be painful, but with the topical anesthetic, it isn't.
Some women feel a sexual boost in as little as a week. Heidi noticed a shift after 2 or 3.
I feel a lot more confident. I feel sexy. I really like being a fully participating sexual being again.
The OShot costs about $1,500 and insurance does not cover it. Dr. Roy says it works for guys too.
Dr. Kevin Aster offers the OShot at Artemis Medical Group in Scottsdale. He says that women of any age can benefit from the injections, but that they're particularly popular with women who are midlife and beyond.
You alleviate some of the pain because as we age, there's dryness and atrophy or shrinking of the tissue that all gets replenished, and it enhances their ability to have orgasm during sex.
The secret ingredient to the OShot is platelet-rich plasma, or PRP. You've likely heard of it being used to treat sports injuries or even to rejuvenate the face. When a patient comes in for the OShot, Dr. Aster takes a blood sample, spins it in a centrifuge to isolate the platelets, and then injects them into the female anatomy.
The platelets are full of what we call cytokines, which are growth factors. Those growth factors then stimulate stem cells, and you get a rejuvenation of the tissue.
This 42-year-old patient says she barely felt the shots. While she asked not to be identified in our story, she was eager to share how the OShot helped her achieve her own Meg Ryan moment.
It's just more intense, quicker. It's not as stubborn.
This mother of 4 also says the shot cured any minor incontinence that she'd experienced since having kids. It's an added benefit that Dr. Aster has seen time and time again.
What's being found with this OShot is almost 100% of the cases of stress incontinence is relieved. It's cured.
Dr. Laura Skelshock, a dermatologist in Boca Raton, is one of a handful of doctors across the country who offers the OShot.
The OShot is a procedure where we utilize the body's own regenerative ability to create new tissue.
Here's how it works.
Okay, ready?
I'm ready.
Doctors draw a patient's blood, place it in a special tube, and spin it in a centrifuge.
There's your liquid gold right there.
After a few minutes,
here's the red blood cells. Okay. There's the gel that separates it, and then this is what we're going to inject.
Doctors then inject the platelet-rich plasma, known as PRP, back inside the patient.
This is the vagina. This is the front wall.
Okay.
And so this is where we're putting it, right between the vagina and the bladder.
What have the results been like for you?
Oh, like fireworks.
Really?
Like fireworks.
Results may not be immediate. For Marcia, it took about 3 weeks before she noticed a difference.
It has probably enhanced my response and my enjoyment more than I ever enjoyed it as a younger woman.
The results are twofold for Marcia. You see, a side effect of the OShot, it actually improves urinary incontinence or loss of bladder control.
It's totally changed my life. I don't have to worry about embarrassing moments. I don't have to worry about urinary tract infections because of wearing a protecting coating. I am in control.
The OShot costs $1,500, and doctors say the effects last for about a year. Marcia says it's money well spent.
just added a whole new dimension to my sex life, to my feelings as a woman, and it's just been incredible. I told you, it's like the fountain of youth.
Welcome. So I am so excited about this. How did it go? Did you feel better afterwards?
Much better. It's more than I could imagine, actually.
And Dale, are you happy she got the shot? Do you notice any difference?
It's absolutely amazing. I had no idea it would work so quickly, and it's definitely given us back a part of our relationship that's been missing since we started having children.
But this patient says she would absolutely do it again.
Do it. It's worth it.
We have sex much more frequently now. It's much more spontaneous now than it was before. We would have to plan ahead. If we didn't have lubricant, there was no sex that night. And now it's much more pleasurable, much more frequently. I have a complete lingerie drawer now that's full of new stuff.
Awesome.
Yeah. What do you think?
Yeah. So I'll go on through the checklist.
Desire is much improved.
Lubrication, natural lubrication.
Natural lubrication now, yes.
No pain?
There's still a little bit, but nothing compared to what it was before. Before the shots, it would be to the point where penetration would be sometimes almost impossible. It was so painful. Now it's just a brief, if there is pain, it's just very brief, and it goes away pretty quickly.
Okay. So. And able to achieve orgasm quicker, easier?
Yes.
Okay.
Much more so.
It made me feel inadequate. It made me feel less of a woman. It made me feel like I can't please my man, things like that, you know. So, you know, and it made me fat too, because I just ate my problems away, you know. I was like, okay, well, if I have to deal with this, then I'll just deal with it. And a lot of women feel that way, I think. I talk to a lot of women, and they're just like, okay, go ahead and take care of that to their man, you know, because they're missing that bonding sequence, you know, the bonding thing that they need to bond with their husbands. And that's why I did it. I wanted to bond more with my husband. We had a really hard relationship before because I did not want to have sex. Every time we had sex, it was like a chore. It was like, oh, here we go again. I got to do this again, you know. And it just was not good. I didn't want to feel like that about my husband. I want to bond with my husband. That's the most important thing, I think, between a man and a woman, is that they need to bond. You know, that's a very important aspect of life.
How difficult was it for you to exercise before the shot?
It was very difficult. You know, I did Jillian, and I did a lot of other things, you know, yoga, running, all kinds of things like that. Jillian likes to do lots of jumping jacks and jumping up and down and butt kicks and stuff like that. And when I do butt kicks or jump up and down, it was really hard for me. It was like I just urinate down my leg, have urinary incontinence, and it was not fun. And then
from stress urinary incontinence, and that's what.
Yes, from stress urinary incontinence. Yes, I knew I was already getting it. You know, that's kind of depressing anyway, because you're like, oh, now I'm going to have to wear Depends when I'm old, you know, and I don't want to have to do that. You know, I want to feel like a woman. I want to feel like a person. And when you're urinating on yourself, it's kind of like, you know, like what's wrong with, there's something wrong with me, you know. And I tried to ignore it. Women try to be strong, and they try and ignore things and just try and go on, you know, because when you have a baby, it's kind of like that, you know. When you're having a baby, it's like, you know, and you're trying to withstand that pain, and it's kind of the same thing, you know, when you're having sex or when you're having urinary incontinence. It's just kind of like you just feel less of a woman, you know. You don't feel like a whole person. And once I had the shot, it was awesome because I could jump up and down, I could do my yoga, I could do anything, you know, and it just makes you feel like a superwoman, like really good, you know, like I'm pleasing my man's happy, I'm happy. If your man's happy, you're happy, you know. If I'm happy, he's happy. So it kind of works both ways, you know.
So here you were having pain during sex. It wasn't a chore, or it felt like a chore. You were holding all of that information back from your husband. You were depressed. Yes. You were eating, you weren't exercising as much or as vigorously as you wanted to, and so you were pretty depressed, you said.
Oh yeah, I was very depressed. I was so depressed. I was 190 pounds. I mean, that tells you I'm depressed, right? I mean, I'm eating my feelings, you know, and I'm not used to eating my feelings. I'm used to exercising and just punching it out and being like, okay, just punch it out, you know, when I get angry or depressed or whatever it is about me that I'm upset about. I'm like, I'm just going to work it out, you know, and feel better about myself, and that really helps me. You know, I think it would help a lot of women. I don't think really people understand until they start exercising, and then they're like, oh, wow, you know, I feel better about myself. My husband feels better about me, you know, everything, you know, and men start looking at you again, and it kind of makes you feel good about yourself, like, wow, you know, I actually look like, you know, I should, and feel like I should, you know.
And so the one thing that was going to help you exercise, you know, the one thing that was going to help clear your mind and get rid of all of that was something you couldn't really do as effectively as you'd like to.
Exactly, yeah, and because it was just annoying. It's like, okay, I want to jump up and down and get vigorous and get aerobic, but I can't get aerobic because I just keep urinating on myself. How can I keep exercising when I'm thinking about, oh no, I'm going to lose it right now and it's just going to go everywhere, you know? I mean, it's hard to think about that when you're thinking about something else, you know.
So your husband told you about the shot, and you didn't
Yes.
you didn't really know what it was at first.
No, I didn't. I didn't really. It's not that I really didn't know it. It's just kind of like a woman thing where you're just like, okay, well, I'll just, you know, whatever, you know. And it's like I want to bond with my husband, and it's like, okay, well, I'll try this just to bond with you. You know, and then after I had it done, it was just amazing. I just could not believe the results. It was excellent. And I just feel so good about myself, and I'm skinnier now. I weigh like 130. So, you know, going from 190 going to 130 is something there. You know, and it also helps my husband too, because he's like, wow, you're attractive, you know, and then he wants me more and I want him more, and, you know, it makes a big difference. It really does. Especially with the sex too, you know.
Well, talk about that. I mean, what is that like now since then?
Well, the sex was more, it was hard for me. I was trying to have sex and feel good about myself and stuff, but it would take longer. I'd have to use more things to entice myself and make myself feel better and things like that, and get to my O. But now that I've had the shot, it's not like that anymore. It doesn't take as long. It's, you know, it feels better. It's tighter, so it feels better to him, and it feels better to me. I feel more like I did before I had children, because I was more like, after you have children, of course, you know, you're going to stretch because the head of the baby, you know, and so I was about like that, and now I'm about, you know, about like that. So I'm actually snugging him, which means, you know, that's the bonding chemical there. You know, you're bonding with someone when you're touching, you know, so.
And how's the pain?
The pain is, I don't have any pain at all. No pain. No pain. It feels good.
Now talk about the shot itself, the actual process. You know, getting a shot down there sounds like it would hurt a lot. Did it?
No, it didn't hurt at all. I thought it was going to hurt, but it didn't hurt. It really didn't hurt. With the clitoris, I had a little bit of a prick, but that was it. It wasn't anything serious, nothing I'd be like, oh my God, about or anything like that. But yeah, it's okay.
And so, and how long after the shot before you started to experience the benefits?
Right away. I experienced it right away. The first night, it was kind of like being a virgin again, because I was so so tight down there. You know, it was like, I don't know, it was just very bonding between me and my husband. I cried, and he was very sensual about it and felt really good about it too. So we really bonded that first night, and you know, that's nice. It's nice to be able to bond with your partner.
So how are you doing today? I mean, how are you now?
I'm doing great. I feel great about myself. I'm exercising. I'm bonding with my husband. He likes sex more. I like sex more. So we're both kind of like exploring each other like new, you know. than before, because before it was kind of like, oh, I've done this many times and blah blah blah, but afterwards it was like, wow, this is like the first time. This is like losing my virginity almost, because it was so bonding with him. It made me cry. I was like, wow, I have no pain. I don't have to worry about that thought anymore. I can just bond with my husband, and it was just so wonderful. It really was. It was great.
Now, are you experiencing more in the way of craving sex? I mean, how's your libido?
Oh, my libido is great. I at least 3 times a day I get aroused. So, or if I think about him during the day, sometimes I get aroused. So, that's a good thing too. I didn't have much of that. Yeah, it's part of that bonding. Yeah, it's really important to have bonding. I think that's why a lot of men and women leave each other, because they don't have that bonding. And they need it. Maybe they've had too many partners each or something like that, and they just, they've had issues, whatever. But all that goes away once you've bonded like you need to bond, and that's very important, I think, for women too, men and women, both.
And you're doing that?
Yes, we are doing that now. Yes, it's almost like a new relationship, like getting to re-know each other, sort of. In a way, it kind of sparks a new spark in your life, instead of kind of like, okay, well, this is the way it is. And me and my husband have gotten to the point now where we've said, and we've told all our stories, and we've done all of our things, so we're kind of like, okay, where do we go from here? And then when we had the shot, it made it a lot better, because then we're bonding again, and it's like we're new again, and it's like we're fresh, like, wow, like you're a new person to me and I'm a new person to you, and it's really cool, and I think it would help a lot of married couples stay together, because I think what happens is, you kind of go like this, because, it's just, there's no bonding there. There's no intimacy there, you know what I mean? And so after I had the shot, it was excellent. I feel more bonded to my husband and close to him and all that stuff.
Well, great. Now, you're talking about some pretty intense stuff, and it's very, real private and personal, intimate details. And I want to say thank you very much for sharing this. It takes an awful lot of courage. There's an awful lot of women out there who, as you know, just don't like to talk about this stuff. They feel, as you said earlier, we're women and we're just supposed to keep it to ourselves. And as brave as that may sound, the consequences of that can be really severe, as you know.
Oh yeah, they can be. Yeah.
And so
they can really
about
be
it is
bad.
really helpful.
Thank you.
An awful lot of women.
You're welcome. You're welcome so much, and thank you. I want to help other women.